Well, I'm Hoda Rashad. I'm the director of the Social Research Center of the American University in Cairo. The Social Research Center, as its name reflects, is concerned with issues that are related to development of Egypt, and development in the Arab region, as well, of course, quite interested in scholarly outputs and contribution to science. However, one of the key features of Social Research Center is its policy focus. We're very interested in informing the debate on whatever challenges, developmental challenges that exist, and we are very interested in linking with policymakers. One of the key features of the Social Research Center, its emphasis on policy support. We're really very keen that we not just produce knowledge, but that this knowledge becomes usable and that the policymakers can build on it and move into interventions and so on. We have a number of themes, but what combines them is that we have a certain vision in terms of what constitutes development, and certain visions on the level of policies and how interventions need to be made. The vision on development is, of course, as is agreed internationally, it's people-centered and it's focused on the well-being of individuals. In terms of the policy level, our approach is to really make a change at more upstream levels and structural level, rather than trying to influence individuals' behavior or trying to change the immediate conditions surrounding people. That's in general. So we have a number of themes that we've selected very carefully. Among those themes, the idea of health, the concern with health, the concerns with health equity is very dominant. And this really ties with our vision, because we look at health, not disease. So we look at health in terms of the well-being aspects of individuals' livelihoods. And we're very concerned, generally speaking, that in our region, the health interpretation is very much a healthcare only interpretation. We fully recognize the importance of healthcare, and we fully recognize that we have major challenges when it comes to healthcare. But we also understand that we need complementarity of efforts in order to avoid the high burden of disease and in order to address ourselves to the healthy population. So if you look at our portfolio and look where our emphasis has been, we have been concerned with issues like NCDs, non-communicable disease, reproductive health of women, infant and child health, social health in general. And the age group we focused on has not, as of yet, given due emphasis to the old age population. However, quite recently, we are feeling that this is a gap, and this is an important phase in people's life that we really have to turn our attention to. And we're looking around and we're starting to feel that the interest is building up. So at one level, our contact with the University of Kent, with Dr. Shereen Hussein in particular, was a stimulus to encourage us to look at this group of people and to try and see what is missing there. In addition, there are some efforts already going on at AUC in other units where there is a serious attempt to conduct a longitudinal aging study. So in a way, the timing is right. Some people sort of object and sort of say, but the percentage of old people in the population is not that high, and we have too many priorities, and we should not really allocate our emphasis on this age group. Actually, I think this is a very simplistic way of thinking about it. First and foremost, aging is coming. And we know from the age structure, and you know from the data, that in the near future, the percentage will increase. But that's not the issue. The issue is if you want to worry about the old age, you have to start from now. If we wait till the percentage become a real challenge, then we don't have anything in place to be able to deal with that percentage. So we're quite convinced that the time is opportune to start now. We also know that the level of knowledge on dimensions of child health, on determinants of child health, is very weak in our region. It's not just in Egypt, by the way. We're talking generally in the Arab region. So it's a combination of factors. You need lots of knowledge to inform the policy. That knowledge needs to be reflective of the context we're living in. We also need to make sure that you put on the agenda of the policymaker the importance of dealing with these issues and preparing for it from now. So that's the idea in terms of the legitimacy of why we would like to work on the old age. Where are we going to work? I mean, if you think of the old age and the determinants of healthy population, I mean, part of our interest of old age would have to deal with the disease part. Would have to, because if people are suffering, then you have to alleviate the burden. So for sure, part of the interest would be to document the profile of ill health. So we will have to have information of that. However, there are aspects of ill health that are really touched. You know, the idea of loneliness, the idea of aging with dignity. This is also ill health. And we are aware that the support system that used to be the family support system is being weakened in our society, while people do not have enough information to establish this as a challenge. But the truth, we have enough data to tell us of the livelihood experiences and how people are living on their own without support system. But that kind of information is coming from very small studies. So in order to be able to even to engage in proper discussion with policymakers who have a lot on their plate, we need to get this information right, and we need to get the stakeholders interested. We need to have consortium of people working together. We need to even to go beyond the research focus. We need to go to the mass media. We need to market that interest. So it's really a very intense kind of movement that requires build-up, and the build-up takes time. Part of it is proper research and scientific action. Part of it is networking and building alliance and putting this topic on the agenda. In terms of the commitment of our region and of the Egypt government to this topic, there are some commitments that are already articulated in the Sustainable Development Goals. So in the Sustainable Development Goals, there are discussion of green space. So there's discussion of transportation that are accessible to the old age. There are discussion of people receiving social support. And these are indicators that the country would have to report on. So at one level, we can anchor some of the political attraction by the political commitment in delivering on bits and pieces that exist in the Sustainable Development Goals, though it's not very high. But I mean, I just want to retract a little bit. It's a life course trajectory. I mean, when we come to the old age, it's the cumulative effect of the burdens across all ages. So that's one level. The other level is in Egypt in particular, and I'm sure there will be a replica of that in other Arab countries, and my focus personally is on Arab countries, and this is why I focus on it. But we can learn a lot from international experience. But if we look to Egypt in particular, we do have a national initiatives that is called Solidarity and Dignity. Solidarity is more related to poverty alleviation for everybody. And part of the Egypt agenda is to look at the old age that are suffering from poverty. But the other aspect of it, which is dignity, I don't think this initiative is as ambitious or as strong as it should be. But it's an anchor for us, because our entry point with the government counterpart is You have a program, an initiative on indignity. Let's discuss what are the elements of that program. The entry point to discussing aging, there are many levels of it. So you could go at the individual level, you could go at the community level. I speak about myself here and maybe a bit of a thematic focus of the whole center and the colleagues in the center. Our thematic focus is in asking the policymakers and the decision maker to act at the level of system change. So everybody talks about the level of health care for the older population. This is a level that we need to cater for. But we have also discussed in terms of system change, the social support. We have to discuss the counseling. We have to discuss how community can be engaged to support the old age. In doing that, the equity lens has to be very strong. Because one of our concerns, generally speaking, and it will apply to the old age, is that we treat the old age as one group of population. What really needs to happen is to differentiate between different social groups, their different types of need, and the different type of services provided to them. So when we talk about, yes, we have health care in Egypt. My key question is, who can access this health care? My key question is about the distribution of health care in different areas in Egypt. That kind of an equity lens has to be mainstreamed across all our discussion of the old age in Egypt. So that equity lens, by the way, is not mainstreamed in all discussions of health, regardless of the age group you're talking about or the dimensions you're talking about. But in terms of old age, since I see this as the beginning of building momentum, let's do it right this time. So let the starting point be the correct starting point. My final note is on some way to make a business case for the interest in old age. Egypt and many Arab countries are talking about unemployment, they're talking about youth bulge, they're talking about youth potentials. And somehow it seems to me that one way of making a business case to the policymaker is using this demographic dividend that's very obvious in the region and making it a win-win situation rather than making it a burden. To make it a win-win situation, then you will have to develop skills, training programs for the youth, develop structures, develop regulatory framework. So that link with my earlier statement, if you want to do something right, we have to start from now, and there are room of doing that, meeting the development vision of the old population and their right for well-being and good quality of life, meeting the responsibility of the state, and also building on the relative advantage of our communities.